Hi, Les? Hi, I'm Dr. Noram. I'm one of the emergency doctors.
Hi, I'm Les.
Can you tell me what brings you to the emergency department today?
I got this cut on my head there, and I just thought that I'd better have it looked after.
I see that. Can you tell me a bit about how that happened?
I was over at my friend's place, and all of a sudden he just picked up his bottle and he hit me over the head. And I don't even know why.
That sounds nasty. Do you know why he would have done that?
My buddy always told me anytime I needed a place to come crash out, just come on over and crash out. And I had a couple of beers, so I brought them over, and I guess he must have had a little argument with somebody else before, and it just accentuated when I got there. I had a couple of beer with me, so I thought, well, I'll take it over to my buddy's place and I'll share it with him. And I guess he had an argument with somebody else earlier on, and he just had somebody to take it out with. So
That must have been a big argument for him to hit you over the head like that.
it seems like my buddy once in a while flies off the handle a little bit more than most people do. It just happened to be the night that I was around.
Yeah, sometimes alcohol can make these situations worse. Can I ask you a few more questions about that?
Yeah.
So do you remember about how much you drank last night?
Yeah, I was drinking at the bar for a few hours before I got to his place. I brought over a dozen beers, so.
So you had maybe 12 beer?
Yeah.
How about any other drugs like pot or crack or cocaine?
I smoke the odd joint once in a while, but I don't do any other drugs.
Is that a pretty typical night for you? Like, how many drinks would you usually have in a day, do you think?
About 5.
Okay. And is that most days of the week? Do you know how many days in the week you would drink 5?
On average, pretty well every day.
Okay. In the last month, what was the maximum number of drinks you would have had at one time, do you think?
About 12 drinks would be about the max. Yeah.
Have you ever felt like you might need to cut down on that?
Yeah, because I really didn't think I was going to end up in the hospital when I went out drinking yesterday.
Have you ever been annoyed when somebody criticizes your drinking?
No, I don't think about it because I'm a happy drunk.
Have you ever felt bad or guilty about your drinking?
No, not really.
Do you ever have a drink in the morning to get rid of a hangover or to steady your nerves?
Once in a while.
And just one last thing, do you smoke cigarettes at all?
No, I don't.
Well, let me have a look at this laceration and see if it needs sutures, okay? Have you thought that you might need to make some changes to your drinking habits at all?
I've been like this for so long, it might be a little hard to change.
Yeah, you're right, it is going to be hard. Well, I think this needs a few stitches.
Oh, great.
Well, why don't we get you to lie down? Could you hold this for me? Just swing your legs up and put your head here. Well, let's talk about some ways that maybe you can cut back. What do you think you could do?
Yeah, maybe I could find some other activities to do, like playing pool or something.
Well, maybe you could cut back to only drinking 3 days a week, or even drinking less at a time. Do you have any friends or family who could help you with that?
Yeah, I think it's possible. I think I know a couple of people I could talk to associate with people that don't drink and stuff. I've been thinking about this for a long time. I'm thinking of changing.
So you're going to try and find some activities that maybe don't involve drinking. You can involve some friends or family members that can help you with your goals, and maybe cut down on the number of drinks that you drink at one time.
Yeah, I could find some volunteerism to do and something to keep myself busy.
Sounds good. Sounds like maybe you're ready to make a change. Well, let me stitch this up, and before you go, I can give you some resources to help you with all of this.
Yeah, that sounds reasonable.